Devon, located in the southwestern part of England, boasts a diverse landscape that ranges from stunning coastlines along the English and Bristol channels to rolling countryside dotted with picturesque villages. Its rich history, including ancient castles and heritage sites, is complemented by a vibrant cultural scene and a warm welcome community. The Devon Alliance for International Recruitment is delighted to mark a significant milestone: the successful placement of 1,000 nurses from across the globe. These dedicated healthcare professionals are making a profound impact, enhancing the lives of individuals in Devon and beyond. Devon Alliance follows the WHO Code of Ethical Recruitment Practices, ensuring recruitment processes prioritize fairness, transparency, and the well-being of healthcare professionals alongside deploying from the Green List countries stipulation.
Our Devon hospitals include 2 city locations. So if people like a little bit more faster pace of life and great shopping and restaurants and busyness, we have 2 city locations, one being Plymouth, which is nearer the coast, and one being Exeter. So that's the Royal Devon University Hospitals and the University Hospitals Plymouth. We also have a hospital in North Devon, which is where Carly lives. And in fact, the photograph on the background of Carly is in North Devon, I believe. It is, isn't it, Carly? And this is a smaller organisation, but on the beautiful North Devon coast, which has some of the country's beautiful beaches. There's some of the best beaches, but that really beautiful, rugged coastline. And then we have Torbay and South Devon, which is on the South Devon coast, and you can see the beach behind me. Again, is one of our local beaches in the southwest. And both North Devon and Torbay, they are very much sort of close to the coast and countryside. So if you like nature and water sports or swimming or kayaking, paddleboarding, all of that, then Torbay and North Devon have those opportunities. But University Hospitals Plymouth also have the same, being close to the coast, but also that city vibe as well. And then we support our mental health trust, Devon Partnership Trust, and we also support our ambulance service in the southwest. So our ambulance service have offices in their emergency operations centres in Devon, in Exeter, and they also have a centre in Bristol. And we've recently been trialling a very exciting project for nurses to be recruited from overseas to work in the emergency operations centres at Southwest Ambulance. So that's been a very new role for us, but also for Southwest Ambulance. And we've recruited some really highly skilled critical care and emergency care nurses to be working as triage nurses in the ambulance service. So lots of exciting opportunities there, and over the whole county of Devon. So Devon itself is very similar to a state in India, but I suppose a much smaller state. But there are also community services across Devon. So where there's care delivered at home, care delivered in a community hospital, which is a little bit smaller hospitals than the acute NHS sites, but nevertheless still have some very sick or highly acute patients in those community hospitals. So there's also opportunities there. So it's a very exciting time. We absolutely support our staff that come and work with us. And as I say, over the last 2 years, we've really been able to develop our brand and develop who we are as the Alliance, and are very proud in terms of the work that we do, and pride ourselves on that pastoral support that Carly and Laura and the team provide. And we know, having met many nurses face to face from all around the world, it's an incredible what's the word I'm looking for? It's in terms of the commitment that you make to come and work and have an opportunity over here is phenomenal. And we absolutely are very grateful of our staff from overseas to come and work with us, and that's why we want to really help and support as much as possible, because of that difference our overseas recruits are making in terms of patient safety and quality, and supporting the workforce here in the NHS. And you know, it's incredible, and I absolutely take my hat off to you for making that decision, because I'm not sure I could, you know, leave my family and get on a plane and travel thousands of miles to come and work for many years. You know, it's sometimes we get homesick when we're overseas doing a campaign. So, you know, for our recruits coming into Devon and into the NHS and into the UK, we know it's a massive, massive commitment, and we're very, very grateful and honoured, you know, that you make such decisions.